If you are watching today, then you were most likely prescribed Coumadin, Warfarin, or Jantoven. For the sake of this video, we will use Warfarin to discuss your warfarin therapy and INR management. Warfarin is an anticoagulant medication commonly known as blood thinners, given to prevent or reduce coagulation of blood, therefore prolonging the blood clotting time. If blood is too thick and forms clots, then you can be at risk for heart attacks, strokes, or other serious medical conditions. Warfarin helps your blood to flow more easily. Reasons why patients are on warfarin depend on each patient's health condition or disease process. Your physician has determined that warfarin is the best choice for you at this time. You will have access to a warfarin team during your warfarin therapy. There are a variety of written materials that we can share with you or send to you via the patient portal. Ask at your next clinic appointment how we can get you set up for the portal if you have not already done so. Warfarin works by decreasing the amount of clotting factors found in the blood, which then decreases your chances of a blood clot forming. Warfarin will not shrink blood clots that are already there, but it will prevent those from getting bigger and keep new ones from forming. If you have existing clots, your physician can monitor that with ultrasound. Warfarin therapy is monitored by obtaining a blood sample and performing a PT-INR level. PT-INR, or prothrombin time international normalized ratio, is basically the number of seconds it takes for your blood to clot. Your MCI provider will set your target goal INR depending on your disease process or reason why you're taking warfarin. MCI has a trained warfarin team that will adjust your warfarin dose according to your provider's orders, INR result, and your goal range. Your provider and warfarin team will discuss that INR goal range with you. Not every patient will have the same goal. When started on warfarin, you will be asked to check your PT-INR once or twice the first week. As your INR level gets closer to your goal range, we can check your INR once a week and eventually 2 to 4 weeks if the INR is maintained at the goal range. If your INR becomes out of your goal range, then testing may be more frequent until we can get it back in range. Warfarin pill colors are the same for every U.S. manufacturer. The milligram strength will always be the same color tablet if refilled with a U.S. manufactured tablet. For example, if you have 5 milligram warfarin tablets, then the color of the tablets should be peach. Or if you have white warfarin tablets, then those milligrams should be 10 milligrams if the pharmacy filled your prescription with a U.S. manufacturer. Let your pharmacist and our warfarin team know if your pill color changes so we can verify what you were actually given was actually prescribed to you. We ask that you take warfarin at the same time each day, preferably in the evenings, in case an adjustment to your medication is needed. This allows time for the nurse to get your INR result, consult with the provider, and call you with dosing instructions. Take your medication as instructed and not what your bottle says. The bottle may only be accurate when the medication was first refilled, but you may have had some dosage changes since then. Never run out of your medication. Call for your refill about a week before running out if your insurance will allow. If you are going on a trip, please make sure you bring enough medication with you for the trip and some extra in case the trip is extended. If you miss a dose of warfarin and you notice on the same day, then you can take that missed dose. If you miss a dose and realize on the following day, do not double the dose. Call your warfarin team for further instructions. Using a pill planner just for warfarin may help you to keep track each day, as well as setting an alarm or putting a reminder on your bathroom mirror. You may be thinking, how long do I have to be on warfarin? Normally, you will stay on the medication as long as you have the disease process or condition that causes your body to create clots. If at any time the condition is resolved, your physician will further direct you. It is very important to let all of your other doctors know that you're on warfarin therapy. This can alter how they treat you and the medications they prescribe to you. There are some normal and abnormal side effects of warfarin. Normal side effects may include some bruising, small amount of bleeding from your gums when you're brushing your teeth, or from cuts and scrapes. You may also have some blood mixed with mucus when blowing your nose. These are normal. What should you do if bleeding is not an emergency? You can contact your MCI Warfarin team and they can give you instructions or make an appointment if necessary. You can call the MCI Warfarin team directly at 331-252-6970, and please leave a voicemail if they are currently on the line with other patients, and they shall call you back the same day. What is not normal to have excessive bruising without an injury? If you wake up and notice a huge bruise to your thigh that you did not have when you went to bed, and you are sure you did not bump your leg into anything, then that may lead to an issue that would need addressing. If you experience heavy nosebleeds, blood in your urine or stool, coughing up blood, prolonged bleeding from cuts or scrapes, or gums bleeding when you're not brushing your teeth, then you need to call your Warfarin team for direction. If you have any significant history of bleeding, please let your physician and a Warfarin team member know. If you experience a large amount of bruising or bleeding that is not resolving, please go to the nearest emergency room for evaluation and treatment. Your dose of warfarin is not determined by age or weight. It is determined by your body metabolism and genetics, so it may take several weeks or months to find the best dose for you. When we get your INR readings, the Warfarin team will give you the medication dosage according to that INR result, keeping in mind any changes to your recent diet, medications, any increased bleeding, or if you've had any recent illness. If your INR is too high, then we may decrease your warfarin dose, and if too low, we may increase your dose. If you have an INR scheduled, please keep those appointments so we can better regulate your medication. If you don't keep those appointments, you can possibly increase your chances and risk of bleeding or forming blood clots. We cannot adjust your warfarin dose without a current INR. If you miss an INR appointment, please reschedule as soon as possible. If you had a home health nurse drawing your PT INRs and you get discharged from home health, please notify your MCI Warfarin team so we can get you scheduled elsewhere. Communication between you and your Warfarin team will be the key to your success while taking warfarin. There are many things that can affect your warfarin therapy and your INR. Some things, such as medications, over-the-counter and prescribed, prolonged illnesses such as vomiting, diarrhea or fever, fluid overload, diet changes, and the vitamin K intake in your diet. Lifestyle changes, exercising, alcohol intake, skipping warfarin doses, missed INR appointments, and running out of medication can also affect your INR and warfarin therapy, which again will increase your risk of bleeding and forming clots. Vitamin K changes the way warfarin affects the blood. When you eat foods that are high in vitamin K, you can decrease the effect of warfarin. Eating less vitamin K than usual can increase the effect of medication as well. Vitamin K can be found most commonly in green vegetables, but is also in a variety of other foods. The key is to eat a consistent number of servings of vitamin K foods from week to week. For example, if you are currently eating 1 serving of green vegetables daily, then we want you to continue to do that if you choose. If you're eating 2 to 3 times a week, then continue. If at any time your diet changes or you decide you need to change those habits, let your warfarin team know, because they may need to adjust your warfarin dose accordingly. Let me give you a scenario. If, for instance, you double the green vegetables you eat this week than you normally eat, your blood will be thicker and your INR will be lower because you ate more vitamin K than you usually do. Or if you normally eat 3 servings a week, but this week you were on vacation and ate none, then your blood would probably be thinner and your INR higher because you were taking a warfarin dose to accommodate those greens in your diet. This is why vitamin K consistency is key from week to week. MCI will provide you a list of foods and the amount of vitamin K in each serving so you can use that guide to stay consistent. The list will show low, medium, and high content of vitamin K in each serving size. Try to keep items such as low sodium V8 juice, grapes, blueberries, blackberries handy in case we ask you to have an extra serving of vitamin K food if your INR is elevated. Illnesses such as prolonged vomiting, diarrhea, or fever can alter your metabolism, which can cause your INR to fluctuate. If any of these occur, notify your warfarin team so we can adjust your warfarin dose accordingly to fit your metabolism, or we can check your INR sooner than scheduled if needed. There are many medications, both over-the-counter and prescribed, that will affect your INR. We do not expect you to remember all of them, but there are certain categories of medications such as antibiotics, anti-inflammatories, cholesterol medications, thyroid hormones, antidepressants, antifungal medications, antiplatelets such as aspirin or Plavix, dietary supplements like Ensure, Boost, Glucerna, or SlimFast, herbals, and vitamins that can commonly interact with warfarin. If you start any of these mentioned, please notify your warfarin team within 24 hours. These things can cause your INR to fluctuate. In most cases, if you're started on any of these medications, we will check your INR within 3 to 5 days. For normal aches and pains, we suggest you take plain Tylenol. It is safe to take 1 or 2 tabs once or twice a day, but if you feel like you need more, please notify your warfarin team, as this may affect your INR. For constipation, we suggest taking Metamucil or milk of magnesia. Remember to drink water with those unless otherwise restricted. For colds, plain Sudafed or original Benadryl is okay if approved by your cardiologist, and original Robitussin for cough. The most important thing to remember is to notify your warfarin team if you begin any new medication, either over the counter or prescribed. Lifestyle changes can affect your INR, such as exercise routine, which can alter your body metabolism. If you currently have an exercise routine, then continue that routine. But if you get injured or ill and cannot continue exercising, please notify your warfarin team so we can closely monitor your INR to adjust your medication as needed. If you're not exercising routinely, but begin some sort of exercise program, again, notify your warfarin team. Drinking alcohol can cause your PT-INR to go up. We suggest if you drink alcohol, do it occasionally. It may be safe to have a serving or 2 in a 24-hour period, but not safe to have more than that. When we speak of a serving, we mean, for example, a 12-ounce can of beer, 4-ounce glass of wine, or a 1.5-ounce shot of liquor. It is not safe to binge drink alcohol. Alcohol is a normal blood thinner, as it can cause your body to make fewer platelets than normal, which are the cells in your body that start the clotting process. So if you drink alcohol with warfarin, your blood can become thinner, increasing your INR and your bleeding risk. Notify your warfarin team if you change the amount of alcohol you routinely drink. MCI suggests you keep an ID card, a medic alert key tag, or a bracelet noting that you are a warfarin patient, so emergency personnel can identify you immediately. We don't suggest only putting warfarin, as it can be mistaken for an allergy. Be cautious around sharp objects. Wear shoes at all times. Avoid any rough contact sports. Wear long sleeves when you're out in the yard or working, or try to avoid climbing. All of this will help to reduce the risk of bruising or bleeding complications. Once you have been on warfarin and managed by the MCI warfarin team for at least 90 days, you may qualify for INR home monitoring. This, of course, will be subject to your insurance requirements. Home monitoring has been shown to be beneficial to so many of our patients. You can test your INR in the comfort of your own home and won't have to go to an outpatient lab for testing or even rely on transportation. This home monitoring meter is similar to the meters that test for blood sugars. Once approved by your insurance and authorized by you, the company ships the meter out, then schedules your training so you feel more comfortable with testing at home. Don't worry, if you have poor eyesight, arthritis to your hands, or some other condition that would hinder you from self-testing, you can get a caregiver who can test your INR for you. We suggest you check your INR on the home meter between the times of 7 a.m. to 3 p.m. Monday through Friday. Once you get the result, then you would call an 800 number and give them the result, or add the result to an app on your phone. Either way, your MCI Warfarin team will get that result and call you with dosing instructions, which is easy and convenient. No more days snowed in or canceled INR appointments. Thanks for taking the time to learn how to manage your INR levels. You are the most important person that can contribute to your health. If you have others who are administering your medications or who do the cooking for you, you can absolutely share this video with them as well. If you have any questions, please ask your Warfarin team the next time you speak to them or your MCI provider on your next clinic visit. We are here to help you succeed and will work with you to help decrease the risk and complications that come with Warfarin. You are important to us and your safety is critical. Thanks for entrusting your health care to Midwest Cardiovascular Institute.